Dawn Sagrillo, Nurse Practitioner and Clinical Director at Refresh. Today we're going to launch a series called Aesthetic in the Know, and what we're going to talk about are common questions that we get asked from patients and hopefully educate you. So one of the most common questions we get asked about aesthetic injectables is, can I bruise? Yes, of course we can bruise anytime we take a needle to the face. The face is highly vascular. However, we take a lot of measures to try and minimize that risk, and we're going to talk about that. First of all, during the treatment, we use something called the AccuVein. It is a device where we can visualize veins in the face and try and avoid them where possible. Secondly, we also use an advanced technique, and we have for about 5 years, called the microcannula. So this is something that we use as kind of like a catheter, and instead of the needle, many areas we can use this cannula to lessen the discomfort as well as lessen the trauma from a needle. Also, we use very tiny needles, and you probably can't see this, but this is a very small needle. Probably can't even see the tip of that, and where possible we use smaller needles than what the product even comes with. We always say it's important to keep in mind who's behind the needle in the syringe. So not only these tiny needles like what we use with Botox, but also our technique and our gentle approach. In addition, we ice throughout the treatment. We use something called this ice roller, and it feels very soothing during the treatment, as well as decreases that risk of bruising, constricts the blood vessels. Following the treatment, we have U-icing, or cooling the skin, very important. And then things that you can do afterward to lessen your bruising potential, and even starting this before. We carry arnica, which is an herbal supplement from the Arnica montana root, and it has been shown to decrease the, I like to say, decrease the blow of bruising and quicken the healing time. We have 2 different forms of that. If you do have some minimal bruising, which again can happen, we have what's called the Jane Iredale Corrective Colors Kit, and we show you how to use this, but it is a great little tool to cover not only post-bruising, but also just other blemishes or imperfections in the skin. And then we also have a broadband light treatment that we can do spot BBL with to break up a bruise and clear it up more quickly when necessary. There are some things that we ask you to do after the treatment, and one of them is to not exercise for about 24 hours. And as well, we want you not to drink alcohol, especially red wine. The tannins in the red wine thin the blood, and that can influence bruising as well. So hopefully this Aesthetic in the Know was educational. Stay tuned for next week.